Casper Bendixsen. He goes by Cap. Cap is a friend, a colleague, and a co-conspirator with me in a lot of the work that we do here across the Central States region. Today, his talk is entitled Doing Agricultural Safety and Health Holistically and Appreciatively with Community Members. So let me tell you a little bit about Cap. Aside from being my friend and collaborator, he's the director of the National Farm Medicine Center and a tenured research scientist at the Marshfield Clinic Research Institute in Wisconsin. He also serves as Associate Director for the Upper Midwest Agricultural Safety and Health Center. He was raised on a farm and a ranch in Idaho, and he competed in rodeo for about 9 years. He completed his bachelor's degree from the University of Idaho and his doctorate in sociocultural anthropology from Rice University. And while he was there, he researched the ethical lives of contemporary U.S. pastoralists. His current work applies anthropological thought and research methods to agricultural health and safety. And so you're going to learn about some of his projects today, but they include investigating the attitudes of farm parents towards children's safety, specifically risk and benefits of children's involvement with agricultural work. And you might hear about some training of rural firefighters related to farm hazard analysis and mitigation and the possible health benefits of diverse and rich biomes that exist on farms. So with that, I'd like to turn it over to Dr. Bendixsen. Thank you so much for being with us.
Thank you so much, Athena. Very generous introduction. Thanks for having me, everybody. Very happy to be a part of today's program and share a little bit of insight. I actually know for a fact that I could learn more from everyone here than I can possibly offer in return, but nonetheless, I've been given a stage and a microphone, so we'll go from here. The title's a little clunky, but nevertheless, I think it does share a little bit of what I hope to go over today. Before we get too far into it, I have no conflicts of interest to report. Me and my family don't have any sort of for-profit business or investments as a shareholder or anything like that, or my employer that affects my ability to share what I'm about to share today. So the path forward, we'll start with some introductions. Athena has told a little bit about my background. I'll have a little bit more, and then I'll ask us to kind of think translationally, think holistically, think appreciatively. When we think about the combination of ag health and safety as both kind of an applied project, as a scientific field, and then really kind of imagine what our roles can be in that, because it's not just for PhD scientists at all, which I hope is clear by some of my projects. And then I'll have some final thoughts and hopefully leave some time for some questions. For those of you wondering, well, what's Wisconsin look like today? It's not quite that snowy, but it's not that far off. That's my better half up front there, Jill, and our two dogs cross-country skiing up here. So our path forward. Like Athena mentioned, I did grow up on a farm and ranch. I think that matters both for context, but also some people ask how I can do these projects and have such ease of buy-in from farm owners and operators, and I think a lot of it has to do with where I came from and who I was prior to any sort of credentials or research experience. So back in Idaho, we raised barley, wheat, and alfalfa, Limousin Angus cross cows. Dad ran a band of 1,000 sheep for a while. We had a remuda of about 40 horses and pack mules, and had an outfitting business where we hunted bear and elk. I competed in bareback bronc riding at college level and the professional level for about 9 years, for better or for worse. Had a good time, made some good friends, but also learned a lot. And then I also was a volunteer firefighter, EMT, and that shows up in one of my projects as well. This is all to say that for all intents and purposes, my plan as a career was really to stay in Idaho and be a firefighter, maybe help my dad farm. But I was asked, you could do well in grad school and be a researcher. And so that's the route I took, but I hope I retain a little bit of who I was prior to that and who I am. I direct the National Farm Medicine Center. So the context there of where I work, the clinic health system, which is serving patients basically the northern 2/3 of the state. And we were the original research project, started off with a project related to farmer's lung by Dr. Dean Emanuel, pulmonologist. But since then, we've done all sorts of research, both at the local level and the national level. This is our goal, this is our mission statement. We really want to be all things to all people when we can, when it comes to improving the life and well-being of those that farm, those that work on farms, those that are related to those that work on farms, and really the rural community more broadly. We're home to the National Children's Center for Rural Ag Health and Safety, and I'll explain why something like that exists and why it's important. And then co-founders in the Upper Midwest Ag Safety and Health Center based out of the University of Minnesota. And we love to collaborate with all of our fellow ag centers across the country, like Central States. This is our crew, very eclectic, multidisciplinary, anthropology, sociology, nursing, occupational health, MPHs, education specialists, programmers, family systems scholars, research coordinators, communications experts. These are a really great bunch of people, and we are the largest full-time working ag center, ag health and safety center in the country. But we're not the only one. This map's a little dated. There's actually one more in Chicago that's recently been funded, but these represent the ag centers funded by the CDC across the country. And the reason I bring it up for even those in the central states, one, you have basically 5, almost 6 really at your disposal when it comes to experts in the field and who can help with this issue of ag health and safety with farm workers and farmers and farm families. But each of the ag centers specializes really in the region. And so sometimes you'll come across a case or a question that is better answered by the ag center up in Seattle. And so one of the main things we take pride in these ag centers is we refer to one another when we don't have the expertise in house, and really that makes us a national resource for everyone, including yourselves. Most of these are based in universities. There are 2 of us that are based in healthcare systems. 3 actually, 3 in healthcare systems. So now our first goal, I'm going to walk us through 2 of my projects and then a concept that Athena and I think is really important. But when I say think translationally, I don't want to get too technical about what translational research is and why it exists and those kinds of things. But I think it points out a major problem with researchers. And so I point that out because the primary problem that we have is at the beginning of the research, we're not involving the community. We're not involving those on the front lines like yourselves. And so the roles we play in research are critical from beginning to end. So a little bit of background on what translational research means and why it's important. Back in the 1990s, it became very evident that discoveries made in laboratories and at universities were taking at least, on average, 17 years to become meaningful and impact the communities they were intended for. And that was a major problem in the eyes of taxpayers, frankly, as well as researchers who really saw things sitting on shelves and not impacting the community. Well, as we move along the translational scale, like there's this bench science, there's this translation from like mouse models when you talk about pharmaceuticals to humans, then you test it on humans, and then you put it in practice, you have clinical trials, and eventually it becomes a drug available for a diagnosis. The same thing, the same concept around pharmaceuticals can be wrapped around interventions like roll bars on tractors, fall prevention. It moves along this scale as well. And you'll see there that as the triangles move down, the role of the community increases. Now, I would argue that the main problem we're seeing is that we're not involving community members and community representation in research early enough. It's too little too late. By the time we get down to these scale, down to this kind of useful model, we really don't have the input, the needs assessments to really say that this was what the community wanted. And so when we're talking about impacting these communities, we're often talking about things that they weren't a part of that research project. So a lot of work now is being taken place where we're taking fairly old ideas, 20, 30 years, we're really recycling them back through this spectrum so that the community adoption improves. Now, all that aside, when we talk about how we do those things, there's a lot of federal support at the beginning of this scale. Like they want these big projects, these large scale research projects at the bench level and in the laboratory and at these large public health universities and schools of medicine. A lot of federal support there, a lot of dollars, some of the second highest investment after the military, actually, when you consider federal dollars. The problem is as we move down where we want to have things in the hands of frontline workers or those that have direct ties to the community, we've really shortchanged them on the funding support. This is not news to this crowd, I'm sure, on federal support for and state support for programming. And you really end up at the service level where you can actually make an impact, where you're really relying on donor funds and community support and community buy-in. And so when we advocate for federal research or when we advocate for programs, we need to really advocate for that evening out of federal support across this translational spectrum. And that would make project implementation, which is where I primarily think of this audience as being so critical. We need more support for that exchange, that translation of, okay, I've done the work. Now I need the actionable people and programs to handle it, but I need the federal support to move it forward. Now, this is an introduction to my first project, which is Rural Firefighters Delivering Ag Safety and Health. And so when I think about the people that I want to work with as a researcher, when I want who I want involved, I want the farm community, I want the farm workers, I want the farm family, but they are a busy group. I mean, it is a difficult task sometimes to get them rallied together, especially for a safety talk. And so it's not always a safety talk that we use. Nonetheless, we asked farmers directly, like, who would you listen to? Who would you take advice from? And I don't think that this will surprise anyone, but as they went through and looked at all the people in their community, and we had them on cards on a table, and they sorted through them to tell us kind of who was a meaningful person in their lives. It was family, fellow farmers, and then right after that, firefighters. And a light went off in my head, and I slapped my forehead. I'd been a firefighter. I had those relationships with rural residents and rural folks and farmers as a firefighter. I knew there was mutual esteem, but I didn't think about that when I was thinking about developing interventions. And so we developed this project to really recycle ag health and safety knowledge in a way that was meant for firefighters to absorb as a incident prevention training and a community risk reduction plan so that they could become the voice, the face, the handshake of health improvement on farms, rather than a researcher in some institution. Marshfield's fairly rural, but imagine a lot of folks thinking a lot of the stuff's coming out of universities, out of urban sites. So here we were with a trainable group, close to proximity to farmers and farm communities, had injury prevention programs of their own within their program. And they're in every county in the United States. Now, we're having trouble with firefighter retention and recruitment these days, but nonetheless, they became our target. And so we developed a curriculum looking at ag health and safety, where we sat them in a classroom for 4 hours, where we give them this introduction material, talking about the main agents of injury, of illness, so PTOs, tractor rollovers, animal crushes, things like that, as well as the expense that it would have on the community when these things happen. And then we went into pre-planning and mapping, and this is stuff that they were really kind of akin to already. They were aware of this because they pre-plan healthcare facilities, for example. But then in this instance, they had to get permission from the farm to go do it. And we have programs that help them do this, farmmapper.org, and Safer Farm is the hazard analysis tool. And so we worked this curriculum with these firefighters, and it was really a test to see if they would show up, to see if firefighters would take on this additional responsibility. And we filled every class instantly. Everyone showed up. They drove through blizzards to take the course. And then we started getting phone calls from around the country that they wanted to also be a part of the program. And so we ended up doing a lot of train-the-trainer events, and now we're getting requests for refresher courses and refresher materials and digital textbooks, and we have these things in the works in our second cycle. But we've trained 78 fire and EMS across 10 states and 5 Canadian provinces, and they've gone out and they've trained. And actually, these numbers are a little old. They've gone out and trained other folks as well. And as I mentioned, we're building this online community, some virtual asynchronous training. We're marrying our curriculum up to federal standards like National Firefighter Protection Agency standards and FEMA standards. And now we're at the stage where we're going to look at evaluate that farmer impact as they implement this program. So here, this is just more of the same. Our website's rf-org. I won't play the video today just because I want to move on to the next project. But my sharing of this is not to advertise from a program or a training. It's to say that when we think about who can have real impact on a farm community, it's very rarely the actual researcher who's doing ag health and safety and doing the health research. It's a community health worker. It's a firefighter EMT. It's a sheriff. It's a nonprofit organization at the front lines who imagine ag differently because they understand the hazards that are part of that for not only the worker but their families. And we tapped into one group, but there's more than that. So I shared that as an example. Now we're thinking translationally, right? We're thinking this is the stuff we're dreaming up in laboratories and engineers and things like that. I've made the argument we need to involve the community at the forefront of this. That's a change for science to really do that and absorb that. But then we're thinking, okay, this has got to move towards the impact, towards the community quickly and meaningfully. Now, the other thing I'll bring up is we need to think holistically. So some of you may be thinking like holistic medicine, and that's not far off, but it's not exactly what I'm talking about. When I say thinking holistically, I'm thinking from my social science background, and that's really the holism is the idea that the human experience needs to be examined as a complex system, the parts of which are only really well understood if you look in light of the whole, right? So a household with its own issues is probably married up to larger systems that are having an influence on that household. And so when we look at what's going on there, we need to keep in mind that it's a part of a community, it's part of a state, it's part of a federal system, so on and so forth. In medicine, it means that when we treat a patient, we can't examine simply the ailment or the injury. We have to examine the entire human being. And this includes their mind. This includes if you look at your insurance, it should include your teeth and your ears and your eyes as well. But nonetheless, we've kind of bifurcated the patient according to these insurance systems, as well as in the hierarchy of medicine, where surgeons fixing the body are king. We're actually forgetting about that preventative medicine, that treating the whole patient at that prevention visit annually. Things are improving, I think, but nonetheless, in the idea of holism, it's treating the entire patient, not simply the ailment. And occupational health and safety, which is the ag health and safety kind of world I'm living in, is really limited to the mitigation of hazards or risk and the treatment of the resulting illness or injury. So it's really like bad thing, fix it, bad thing, fix it, bad thing, fix it. So it's a filter, it's a guard, it's a removal of the person or refinement of the system. But when we want to think really holistically about a person, there's this idea that we have to work, and some work is the 3 Ds: dirty, dangerous, and demeaning, and some work is not. And then there's types of work we like to do, and there's types of work we don't like to do. And in that world of what work is, it's a third of our lives. It impacts more than our paycheck, and there must be some benefit beyond pay for most jobs when we look at why people do the things they choose to do. And I realize that's a position of privilege if you get to choose the work you get to do. When we talk about farm workers, many are choosing that as their best alternative. And so I want to think carefully when we think about who's farming, who's choosing to be a farm worker, who's choosing to be who has to be a farm worker. But nonetheless, when we think about thinking holistically, let's think about what the benefits of work are. And this isn't to say that we need to ignore hazards and illness, but the approach to the farm community, especially if it includes an appreciation for what's valuable about the work, what's important about that work, that is making barriers of trust easier to overcome, because they realize that we're appreciating what they do for a living, what they work hard at. So that idea of holism, I've been talking kind of about adults. I mentioned the Children's Center at the beginning of the call. The reason the Children's Center exists is that essentially about every week or so, we have a fatality, a child fatality in the United States related to agriculture. Half the fatalities are working youth. So those youth that are getting paid to do a job, whether that's delivering pizzas or working in a kitchen or fast food, half of the workplace fatalities in the United States are agriculture. So that's why the Children's Center exists and why it has a 25-year history of trying to reduce these cases of child fatality and child illness. So that's the burden, and part of that is injuries. And so when we look at cows and kids, which is the Farm Kid Paradox Project, we know that large livestock is the primary cause of injury, non-fatal injury, but nonetheless injury, about 33 ag-related injuries every day in the United States. However, we also know that kids that grow up near livestock have reduced rates of asthma, allergy, and atypy. So there's something about growing up in that cow environment that is preventing a debilitating disease like atypy and asthma. And so these are conflicting, scientifically based facts, right? We have this paradox of, like, we know there's value in raising kids around cows, and we also know that they're causing injury. And so how do we navigate those waters in terms of safety professionals convincing parents as the primary decision maker for the child to absorb the risk with those benefits? And this project examines, interviews farm parents of beef families and dairy families, and then safety professionals. And we're really showing how far apart they are cognitively about risk benefit calculations and the values of why take more risk than less. Sometimes they're on the same page, a lot of time they're not. And so we hope that by looking at both groups, the safety professional and the target impact of the target intervention group, the farm parents, that we can build better material, right? That appreciates what they're trying to do with their kids, so that they'll absorb the safety message easier. So this is just a little bit of data about measuring the benefits, right? So asthma is a globally debilitating disease. It's arguably one of the most expensive diseases in the world because of how it debilitates workforces. And so asthma is this kind of critical, respiratory disease that we can only treat, can't really cure it. But there's something about growing up in these farms. These kids don't start down this atopic march, is what the immunologists call it. But clearly has to do with rich, diverse microbiomes. So you can see the rates of asthma and allergy and rashes, they go down with the more and more diverse that farm environment is, and frankly, how diverse an environment the mother was working and living in when she was pregnant with that child. There is definitely you can tell a difference between farm moms that were engaged with livestock handling versus not. And those kids that were in utero when they were handling multiple species of animals and their feedstuffs and their manures, those kids do not get allergy, atypy, or asthma. So those are easily measured. We're doing that currently. The less easily measured ones are like this belief that raising kids on farms, you get a better work ethic, you get more sense of responsibility, more a healthier understanding of life and death and food cycles, improved empathy in the care for other living things, practical skills, problem-solving skills, math and science, and STEM and ag education are closely akin to one another. The challenges of measuring this is every parent thinks their kid's great, right? So there's a parent bias, my kid's bigger, stronger, faster, and it's in the water, right? Then there's also this rural and agricultural exceptionalism. So in the United States, we know the ag community is held in high cultural esteem. And it's also a social adaptation to living with less, right? So there's an economic study up in the Northeast that farmers said that they would keep farming for $30,000 or less in their increase in their paycheck. So it would take $31,000 basically to convince the average farmer to change their job that year. So the value of doing what they want the way they want to do it was about 30 grand. And that's farm owners in the Northeast, a really small economic study, but makes a point, I guess. And then this idea of social acceptability and then self-serving bias, like I'm a parent, I'm a farmer. And so of course I want to have a belief that we're doing things right. But if we continue down this path where we're not going to have strong labor policy around kids, or we're not going to have better rural childcare facilities available for these parents, and there's not, we're not going to have these punitive effects, then we need to work with the perceived benefits and social esteem. We need to have that. And I would say that goes for all patients, not parents and kids is my example, but I think when a physician or a nurse or an MA takes the time to understand how the dairy industry works, they're going to do better in a place like Marshfield, Wisconsin. And if you understand beef systems and grass systems in Nebraska and Kansas, that moment of appreciating what that person does for a living and probably why they're coming to see a medical professional at that point is important. Now, I want to have a caveat here when we talk about kids. So there was a federal hearing earlier this year, and there was such a clear difference between a Hispanic Latino woman's experience as a kid joining her parents in the field versus another woman who had grown up and eventually became part of Farm Bureau. And they both grew up on farms, right? But the experience was completely different, right? One was a point of privilege, cultural enculturation. The other one was out of necessity. And it was at a mitigating risk for that kid to have them in, albeit another risky environment. And so to be able to absorb all these benefits is absolutely a signifier of privilege. But nonetheless, if we come to this appreciating what's going on, we have a better advantage of inserting ourselves into the improvement of that person's well-being. This is just another study looking at the microbiome. So when we look at the nasal passages and the skin and the gut microbiome of those adults that work with cows versus those that are office workers, it's wildly different environments. The ecologies are crazy. And I'm not a microbiologist by any means, but I've hung out with these guys long enough to see them get really, really surprised with the data. Essentially, the nasal and gut passages of dairy workers, those that work around cattle, are 30 times more populated and 100 times more diverse. And there's no MRSA in there, for example. So MRSA is a clinical infection that ravages hospitals. But for whatever reason, this environment around cows, these dairy workers do not get it. There's not room for MRSA in a hyper-competitive nasal passage and gut system. And so this is when we start talking about like farm as medicine. So the idea of being holistic, this idea that farms can offer medicine and offer therapies for other diseases while still being a dangerous illness-causing, injury-causing industry of its own right. So I want to move now into thinking appreciatively, and so I've described kind of two sets of projects, and this is where I want to get closer to this idea of structural competency, which is something that Athena and I have had the opportunity to work with Seth Holmes, who's well known in the world of migrant health, and this idea of structural competency. But just to wrap up here with the last set of projects. When we think appreciatively, we're recognizing, those benefits of being involved in ag. We're doing that holistic. There's pride in succeeding in difficult work and providing for a family. There's also benefits for being in green space with livestock and microbial diverse environments. But we also need to appreciate the specific challenges that others face that we may not, other people in the same industry may not face. And so when we're thinking appreciatively, I do think about this concept of structural competency. And this is a training that was designed by Seth Holmes and colleagues, really meant for physicians who were treating migrant workers and immigrant workers kind of along the Western coast, where there was plenty of people that were qualified to treat the ailments and injuries of people coming up through South and Central America and Mexico into the United States to work. But these physicians weren't thinking more broadly. They weren't thinking across the system that these people were living in. They were simply treating the ailments repeatedly of what they were seeing without thinking about what the causations and some of the other factors in those persons' lives. And so he wanted to change medical training so that physicians would understand that they need to insert themselves into activism and organizations that bring about change at a structural level for these farm workers, whether that was a visa program, whether that's access to healthcare insurance, whether that's protections from harassment and law enforcement, these types of things that would prevent someone from seeking care in general, but then also the nature of their work and the vulnerability built into how they get here and how they live their life, so that they can be healthy and have their protections at work and at home as they deserve. And so this idea of recognizing the influence of these social structures on patient health, the influence on the practice of healthcare, right? So where you practice, how you practice is constructed. And there are going to be organizations like your own that are closer in proximity and have a better understanding of that patient. And that's a critical role that someone can play in the practice of healthcare, even if you're not a healthcare professional. But then also migrating into the clinical setting. So literally there's structures within clinics that are preventative as well. And then having humility. And so this is just a graphic that kind of shows this idea of what structural competency means, what it means to really understand all the influences on an individual and a community's health. And so those ideas of policies, economic systems, and social hierarchies. So we're closing in on 9:45, which is where I wanted to kind of make sure I had left time for questions and discussion. So my final thoughts, when we're imagining what our intervention population is, because we have a mission, we have a community that we care about and that we want to be a part of. We want to be a part of that well-being and a part of that improvement. It's beyond working with an individual, right? It's always working with a family and always treating them as an entire person. So not just their work, I'm trailing off there a bit because I realize I didn't finish my first bullet. But when we think about treating that person holistically beyond the work, it's a part of their social structure, their family, the other systems that impact their behavior and their vulnerabilities as well as their strengths. And that may be part of thinking about the benefits of work and building on those benefits and appreciating them as an avenue for working towards the hazards. And then we want to think appreciatively, right? There's value in both work and lifestyle, and that can go underappreciated in a person's life. So that may be the well-being of their kids and what they're providing. But if we think appreciatively, we're going to bring that to the table. We're going to change the relationship because we're not just going to be talking about the difficult things in life. We're also going to talk about the successes and the accomplishments by either virtue of hard work or the environment that they're in. And keeping in mind that those challenges are significant, especially for those that are more vulnerable. And then we want to think interdisciplinary. We want to think across professional fields. There's not enough health and safety professionals to go out and do the work. This is not possible. We need to think broadly in terms of our partnerships, who's absorbing what. The fact that sometimes that health and safety message, you're not even going to hear it because it's going to be about affordable and licensed childcare available in rural areas. And people aren't going to immediately think, well, that's going to prevent my kid from falling off a tractor. They're going to think that's going to be good for work and lifestyle and home lifestyle. So there's going to be health and safety embedded in other programming and what it does, and those roles for those community members that organize those things, that is their role. And if they understand what they're doing, they're going to keep that in their heart when they move forward with that work. And then understanding where they lie in the system. So this idea that I'm preventing child injuries by providing childcare. If I'm advocating for workers' rights, I'm also probably preventing a cancer from developing. These kinds of things are tied together. We need to understand the whole picture. And then success is entirely dependent on the ability to translate research. Facts, in my opinion, facts are better measured when they actually show their impact in their implementation. In a peer-reviewed research article, it's great. It's good for academics, but some facts are more valuable than others. And that's really clear when we talk about impacting the lives of farmers and farm workers and farm kids. And then effective translation, it really, it depends on community adoption, but also going back to the first premise, it involves their involvement in program development and research questions early in the process. So I'm going to wind down. These are my funding acknowledgements. Very fortunate to have some support for these programs and these projects. And then I'd love to open up for questions.
I want to thank you so much, Cap, for your presentation this morning. I'm going to kick us off with a question for you. And then we'll open it up to everybody else on the call. Feel free to drop questions in the chat, or if you'd like to unmute, you're also welcome to do that and ask your question directly to Dr. Bendixsen. So many of the people on the call today are working with the migrant education program. They're doing or Proteus and doing direct outreach with farm workers and farm worker families. What ideas or recommendations do you have that maybe we could try, that we could test, or we could pilot here in Nebraska around reducing structural barriers for farm workers and farm worker families?
So I think as a social scientist, we imagine this broad category of social structures, and economics gets in that bucket, policy gets in that bucket, people's attitudes and their beliefs thrown in that bucket. But being thrown in a bucket does not lend itself to any priority, right? And so this is where, going back, the community needs to be involved with the creation of what goes in that bucket. And so we need to understand their perception of what structures are impacting their world. And then we also need to go through and ask them which ones are the most important, which ones are having the greatest negative effect on your well-being. Because if we go in and I'm only interested in childcare, I've got a hammer, there's a nail, I'm going to beat on childcare as the solution. And it might be for a number of people. And I'm not saying that it's definitely part of the equation, but along the way, I really haven't asked that population, what's your priority? And if we do that, I think we're going to probably uncover a couple major issues like migration policy. I think people are going to say that it needs to be easier to be a worker here. It needs to be easier to be a legal part of agriculture and a part of society here. And I also need to be able to maintain a healthy way of returning to my family, if that's the case and they're separated. So I think that one of the main things that we have to do is we have to get the community's priorities before we make any sort of attempts at trying anything. The thing that I would look at and attempts to that have some evidence base, I do believe it is a priority when we talk about childcare, especially as the number of female workers is continuing to go up, and with split responsibilities between working and raising children. Along the Eastern Seaboard, we know that employers that had childcare on site that worked with Migrant Head Start, those became employers of choice. And so the workers would return there, which is good for the farmer and the farm owner. But then we knew that their children were having their records kept straight. They were staying in the same grade, getting the same curriculum they're supposed to get, but then they were also being removed from the work site. And so when you think about childcare as an issue, I wouldn't think of it as a standalone daycare system, education system. If it's embedded within the farm system, that is going to reach not only the farm worker, it's going to impact the farmer and bring about a benefit boon to both. And that's why I think a better systems approach to one intervention like childcare is good. The other thing that I would advocate for that has been evidence-based and I don't think we need to hesitate is community health worker models. I think when you create experts, you're lifting an entire community around them. So by creating more expertise in the farm community, in that farm worker community, you're giving them resources that they get to keep, as opposed to resources that could go away. So that idea of education and creating expertise, I think is something else I would advocate.
Thank you for that. Yeah, I love that. Building capacity. We talked about building community capacity yesterday, and maybe trying to think through some ways that we can do that and build more expertise within communities. And I like your idea around asking people, what are the issues? I think those are important. So let's open it up to other questions. Feel free to unmute your mic or drop a question in the chat. Danny, please.
All right, sorry about that. Hey, good morning, everyone. Dr. Bendixsen, thank you so much for presenting to us this morning. I think that was a lot of really good information. I do have a quick question about development and implementation of programs. You had that one graphic that showed the two scales going up and down about federal funding being going down as community adoption goes up. Can you speak more to that piece about the transition and for us who are potentially developing programs where we have gotten some sort of initial funding, whether that be from federal funds or from some sort of private foundation or something, with the idea that it will teeter off so that we can have that buy-in from the community. Can you talk a little bit about that transition piece and how we really kind of nurture that?
Yeah, honestly, that's kind of where I swim every day, is in that where those two triangles cross over, because I do benefit from great federal support, but I think this idea of implementation has gone underappreciated for basically everything maybe for the last 10 years. I think where implementation science and dissemination science has been fully appreciated at the same level as other programs, but still underfunded. So even in like the clinical translational world, so pharmaceuticals is kind of the easiest example of this idea that now, before you even start at federal support, you need to have a dissemination implementation plan. So it's no longer, I've got a great chemistry idea. I actually have to explain how I'm going to move chemistry into the patient world. And so the requirements for the federal support are going to change to some degree, because they're going to want that implementation and dissemination plan. The strongest approach to those programs now is partnerships. I think that when we apply for grants and when we apply for state funding, they believe that they're planting the seeds of partnership. It's good for the theme today, by supporting this idea that I'm a researcher, but I've got these nonprofits on my side, and we're agreeing to do these things together. My first advice is, don't do that for show. Don't do that for grantsmanship purposes, which is where I think a lot of scientists and a lot of researchers and university folks, unfortunately, that's their downfall. Is they kind of build up this letter of support, and then they get to their project and they kind of live without their community partner until the very end of the project, where like, hey, we did it, here it is. And so the primary thing is for me, like the rural firefighters delivering ag safety and health program, like that to me, we don't make a move without Chief Jerry Minor, who's our main guy. But we have this group of like 5 or 10 really bodacious, great firefighters that want to be a part of the solution. And so when you think about that programming, look at your partnerships and bring in those that are a part of that have the vigor and the excitement for what you're doing. And then as you move into where the federal support runs out, that's where I begin to think about what role different industries can play. It's very rare to find someone who wants to own the entire thing. So when we think about RF-, I talk about insurance companies. Insurance companies are one of the primary benefactors of that program, because both farmers and sorry, my little one just took a tumble. Firefighters and farmers are both high-risk insurance customers, and they get lumped into the same high-risk pool and spread evenly across insurance companies. So that's really boring insurance talk. However, what that means is when you're preventing farm injuries and property loss, and you're preventing firefighter injury as a result of the program, they're benefiting. So they can buy the donuts, they can buy the coffee, they can buy the lunch, they can give you the rental facility. And so we've imagined this role of insurance in both the program, but then also had them commit to, if a farmer makes these changes on their farms, would you reduce their rate? And we have a couple of mutual companies that said, yeah, we will. And so, but they're not going to own the entire thing, right? They're going to own that one piece of it. And so you begin to develop a playbook, right? You hand that playbook to that community partner of like, this is who you need to ask for policy change. This is who you need to ask for to help with developing the program. This is the long-term education system that I would invest in, like a technical college. And so you begin to think as a network, not just as a single partnership. Long-winded, Danny, but I think that it's a complicated space right there, because it's very rare you find that one partner who can do everything with you.
Thank you, Cap. We have a question in the chat. Does the farmer have medical and health insurance for migrant and seasonal workers?
So there's, Athena, you're going to be a better respondent to this one. What I will say is that it's a mixed bag, dude. It's a mixed bag. So when you talk about health insurance, whether or not you need to provide that for your worker, it depends on the nature of the state laws and the federal laws that are taking place there, whether you need to provide something, and if they are there long enough to meet the requirements to have health insurance provided. When it comes to workers' comp insurance, so like if someone does get hurt as a part of their work, it really depends on the state. So worker comp insurance, for example, in Washington and Oregon is required of every employer who has one employee or more. In states like Texas and Idaho, workers' comp is optional. You don't have to carry it regardless of your volume of employees. And so that terrain is very uneven, and that is to the disadvantage of the worker because it is so uneven. So Athena, you're going to be a better respondent to that question.
Yeah, there is no requirement for health insurance, and for workers' compensation in Nebraska, agricultural employers are typically exempt from workers' compensation requirements unless they are using workers that are coming on the H-2A visa program, in which case they would have to provide workers' compensation to the workers, but they still wouldn't have to provide health insurance. All right. Any other questions from the group this morning? Well, it's been great.
Thank you for having me, Athena. I really appreciate being here, and I hopefully didn't provide too mixed of a bag. But I just across my research portfolio, I hope that there's some tidbits in there that everyone could walk away and realize that it is a community effort, it's a group effort. No one's doing this as a Hercules. And I appreciate everyone being here today.
Well, we appreciate you. It looks like we do have another question. What happens if it's a minor that has an accident?
So when it comes to youth working on farms, it's further complicated by the idea of chores. I grew up doing chores. I was not a worker. I just did chores, and maybe I got an allowance that was pending whether or not I did a good job with my chores. Working on the neighbor's farm, that's all that can get difficult. And normally you're being paid in cash, so you're not really a formal employee in that regard. And so who takes care of what? I would say most times I would wager in kind of a chore environment or working for the neighbor, it falls back on the family's health insurance plan, and their responsibility and parents' responsibilities, or the owner of the farm. When a youth is hired, again, depends on the state, whether or not they have health insurance from their employer, and whether or not they qualify for workers' comp. The main issue that comes about with youth is usually there some degree of neglect. So with adults, whether or not they were properly trained is still a critical question. It should always be asked whether or not someone was trained to do a job correctly and showed to be proficient before letting them do it independently and have a deeper understanding of the job they're doing. That's especially true with youth. So the examples of some of these tragedies are 3 years ago, there was a Plain community woman with her 5 children with a skid steer, picking rock in a field, and a 5-year-old, I have a 4-year-old, she was letting the 5-year-old drive the skid steer. The 5-year-old ran over the 2-year-old with a skid steer. So in that scenario, kids working as a part of the family, they were picking rock together. But in that case, and that was seen by a judge, and the judgment there it was a tragedy, and they had to do some safety training. Another example, a little bit different. The next year, there was a 16-year-old on the Minnesota-Wisconsin border driving a manure truck. He was 16 or 17, I can't remember. Thank you for putting up the work guidelines there. And something was not working, and decided to go into the tank. In the tank was full of noxious gas. He succumbed to the gas and was killed. And the 16-year-old, that scenario of he was never trained to go inside the tank. No one goes in the tank, but probably wanted to fix it himself and not have to ask his boss or his uncle or whoever it was that was meant to be supervising him. So the 16-year-old just didn't ask for help because they wanted to impress. They want to be an adult. They want to be grown up. And so they make those decisions that they think a grown up would make. In any case, it is a mixed bag when there's a kid, and then usually that topic of neglect and training is a higher profile question than with adults.
Maybe Cap, while we have you on the spot, maybe you could talk about the agricultural youth work guidelines.
Right. So going back, this idea of a tragedy of fatality a week, it's just beyond the pale. And some farm families just don't even believe it. But the epidemiology is a little old now. It's getting to be 10 years old. But we do know there's a number, and they usually make the paper. So we do track them in kind of news media. They still happen. They still occur. And the approach here is that there's only a few labor laws that touch on whether or not a youth can do a job, and that includes highly dangerous work like chainsaws and things like that. But in general, most agricultural jobs are fair game for any youth. And 2014, they tried to pass a federal law to control what jobs youth could do. And it was misconstrued as not letting kids do anything on farms and not wanting kids to grow up on farms. And so in light of that, there was a more active effort on the National Children's part and everyone's part to say, okay, if youth are going to do these jobs, we have recommendations on when and how. in their lifetime. And so the work guidelines are typical jobs that we expect youth being assigned, and they're built on ability, not just age. It's so, there's an argument that a 12-year-old actually does a better job than a 16-year-old because they actually listen to you. Right. So it's based upon the idea that they have the mental, emotional ability, the ability to retain information, reiterate information, and being strong enough, big enough to do the job, having reaction skills that are strong enough. And so that idea would be along the lines of, this is a guideline based upon a youth's ability, whether or not they should be assigned that work. And when I talk about the farm kid paradox, we want to build into these guidelines some of the goals that parents have with assigning this work. So they want kids to understand how cows move. They want them to understand how horses move. And so learning an animal's behavior is a skill, and they have that skill. And so in this kind of safe animal handling guideline, right, we want to include things like understanding animal behavior, increases one. If you can think like a cow, if you can think like a horse, then you have better empathy. And so that idea. But anyway, those are the work guidelines. And we have them both for hired youth and for simply working youth.
Yeah, I think that's a great distinction. And these guidelines are searchable. So you can put specific criteria that you're looking for and be able to look at the guidelines. They're also available in English and Spanish and French, correct? Yep. So they're available in 3 different languages. We had a question that came in, and it's regarding responsibility to parents. So what if a parent brings a kid to work and the company doesn't even know that the parent is bringing the child to work? What should you do in that situation? What can you do with the parents to help raise awareness with the parents or a company, or how do you walk that line?
Yeah, I mean, so as a guy who had to give his 18-month-old 2 baths this morning in between, and then having come back home to work, the first thing I want is grace, right? I want a certain degree of grace. And so the first question I would ask is, what's happening today that you have to have your child with you, right? And that would get at the structural problem, which is probably they're ill, their childcare providers are not available, not reliable. At the end of the day, that child is not meant to be in that work environment. And so in the effort to have them on the job, if you have a reasonable employer, if you have a reasonable manager, you try to find a space where the kid would have some ability to be safe, right? So that would be an office environment, perhaps, something off the line, right? Something, or you work towards alternative care, so that worker isn't distracted in trying to maintain safety for their kid and their work. And that really, there's the upshot of youth safety and not being in those environments is then you don't have a distracted adult. So distracted work is dangerous work, regardless of what you do. And so this idea of I can take care of my kid while I do these things. And I've seen everything. I've seen playpens in the ends of dairy alley. I've seen car seats in the buddy seat of a tractor. So this idea, and which are examples of best efforts to confine the child away from the hazard. But the probability of something happens reduced, it's not eliminated. So alternative jobs, having grace and thinking empathetically about like what's going on in this person's life and being prepared for it. Employers should not be surprised when someone comes to work with their kid. This should not be an oh shucks moment where I don't have a plan. It happens in every work environment. And so if you're surprised by it, you're not paying attention. Like it's like this. So this idea of workers are parents, and then workers are also children themselves. And so one day you can't show up because you're caring for an elderly person in your family. Like that is going to hit our economy hard as the millennials start to take care of their baby boomer parents. the work environment is not prepared for that work-life balance. Anyway, that's another tangent, but good question. It's a tough, that would be a tough scenario.
Yeah, this has been a really a great discussion. There was one other question that I did want to answer, and that was related to potentially hazardous work. So there's lots of parts of agriculture, kind of like we talked about yesterday and this morning, that are very dangerous and that are considered hazardous. And technically, per the law, hazardous work is restricted to people who are at least 18 years of age. So I am going to put in a link here for hazardous work and what is considered hazardous work in Nebraska and would be prohibited under age 18. So hopefully this morning you've learned a little bit more about agricultural health and safety, and doing it, being a part of it from the beginning, because I think Dr. Bendixsen asked us a really important question: is who can have real impact on communities? And I think the answer is all of us can have real impact on communities. He also talked about how can we do this more holistically and see people and as part of more complex systems rather than just workers. And I know a lot of us around the table think of all of these farm workers and farm worker families that we all serve as real members, active participants in our communities, and as friends and as partners. And so I really appreciated that idea of holism, and hopefully we can spread that to other people, other departments, and other systems so that they can learn to see people more holistically as well. And then finally, he talked about how can we do this work more appreciatively, and not always looking at what's wrong and at deficits, but also realizing that there's a lot of strengths, there's a lot of capacities, capabilities, and assets that we have in communities and with the community members that we work with. So again, I want to thank Dr. Bendixsen for his time this morning, and we really appreciated you being able to join us. You now have 63 other friends in Nebraska. So
It's more friends than I've got in Wisconsin now. So
thank you again for being here. And if anybody has other questions for Dr. Bendixsen throughout the day, you can always send them to me and I can get them to him, and we can get you an answer for your questions.
And I did put a link in there, or a web address, cultivatesafety.org. That contains the work guidelines, as well as all the other materials that have come out of our center, and they're all for free. We want them shared widely.
Thank you again.
Thank you, Athena. Thank you, everyone.